Hey there. Today, wanted to talk about the VA. In my experience over the entire timeline, I've gone to the VA. They have benefited me in different ways at different times and severely let me down and shown how dogmatic they are or just limited, which I don't normally talk about the VA. Otherwise, if I am, it's on an individual level with another vet, usually in their experience with the VA, which isn't good usually. But I'm talking today specifically about a letter I got a month ago. This isn't the first time I've gotten this letter, but this is a bigger deal to me because this seems like this is the accepted standard of care, which is bullshit. And they even point out that they're calling this the highest quality healthcare, which is mind-boggling because this is the absence of healthcare, which you'll see. I'm going to read this letter to you. So it says, from Department of Veterans, Department of Veterans Affairs. I redacted some of the doctor's information and my address. Dear veteran, I am writing to inform you your current primary care physician at the Savannah VA clinic, Dr. Number 1, is being replaced by Dr. Number 2, and Dr. Number 2 will be your new primary care physician starting in the middle of December 2024. Dr. 2 is part of the VA's clinical resource hub based in Atlanta, Georgia. I live just north of Savannah in Bluffton, South Carolina, not Atlanta. Dr. Number 2 will provide care through a combination of telehealth appointments and periodic in-person appointments. To complete your primary care appointment, you will check in as usual at the Savannah VA clinic. So I got to drive to Savannah VA to then do a telehealth appointment with a doctor from Atlanta. So far, none of this makes any sense. Your nurse will escort you to an exam room, take your vital signs, and begin your appointment. For telehealth appointments, you will communicate to Dr. Number 2 through a special telemedicine cart in the exam room. Dr. Number 2 will not be physically present in the exam room. Probably shouldn't be called an exam room then, since that's not what you're using them for anymore. However, the telemedicine cart is outfitted with a special stethoscope and other instruments that allow your nurse to assist Dr. Number 2 in completing your exam. We understand that changing providers is challenging. At a systemic level, they understand that changing providers is challenging. They're not recognizing that they're removing the provider from the fucking room. And they're still calling it providing? What in the hell? This is getting more confusing. We understand that changing providers is challenging. It is important for you to know that your treatment team remains committed to providing you with the highest quality healthcare moving forward. The highest quality healthcare moving forward is a screen that has a doctor on the other end in Atlanta, but I have to drive to Savannah to access that screen. That's the highest quality healthcare, huh? If you have a future primary care appointment at the Savannah VA clinic, please plan to attend your appointment as usual. Nothing is the same though. Just go ahead and plan to attend as usual. This is normal. Your other VA providers and scheduled appointments will not change. If you would like to schedule an appointment, contact us by calling this number or sending a message to your team using My Healthy Vet. Sincerely, Savannah VA Clinic. Look, not even a person. So, I have a problem with this for myself. I have an even bigger fucking problem with this because I have friends that are retiring now after 20 years of service. Some are continuing on, but this is what they have to look forward to after 20 plus years of service, over a dozen deployments. That's the standard of care that the VA is striving to achieve, and not only striving to achieve, they're simultaneously labeling it the highest quality health care. By removing the doctor from the room and replacing it with a screen and a special stethoscope and other instruments that allow the nurse to assist doctor number 2. I don't have a problem with the doctors on an individual level at the VA. I have a problem with the VA and whoever's in charge and whoever's in the organization accepting this as a standard. Whoever brought this up should have been punched in the fucking head, fired, and kicked out of healthcare. This is the absence of healthcare. This is not an acceptable standard. This is why the World War II veterans that are still alive, the Korean veterans, the Vietnam veterans, every veteran, especially the old ones, the ones that aren't young enough to complain about this aloud on a video and post about it, the ones that can barely get through the day or find a ride to an appointment anyway. Those are the ones that this is not an acceptable standard of care. I'm adaptable at 40. I can drive to Savannah. Guys that are in their later stages of life don't have that ability. And why the fuck would they drive to an appointment that's virtual anyways? This is so counter. This is not healthcare. This is not the way that healthcare should be moving. And they're at the center of healthcare used to be humanity and compassion and service, and we need to get back to that. That's it.